Before we introduced our healthy lifestyle programs, the Port was solely focused on safety, which meant a focus on incidents only and trying to determine the cause of an incident. Back in 2011, we realised we had a huge cultural problem. Our LTIs were very high as a percentage of the workforce. Our absentee rates were very high. We recognised we worked in a remote location, not a lot for staff to do in the lunch hours, difficult for people to make the decision to come to work. That was costing the business money, time and poor engagement with the staff. In 2010, the Port of Brisbane would accumulated 45 claims to a value of $86,000 in compensation. So in 2011, we decided to turn the whole health and safety culture on its head, and we implemented a new health and safety management system. What that did was focus more on health and wellbeing as much as safety. Since introducing the program, in the last financial year, they've reduced to 19 claims at less than $36,000.
Since becoming a lot more involved in the construction industry, I noticed that there was a lot more need to spread the healthy worker message. I guess when health and wellbeing became our focus, we started putting up little posters and things around our workspaces, and from there I started implementing healthy cooking classes and teaching the blokes about health and nutrition, teaching them how to cook rather than actually going down and visiting the canteen down the corner and buying something out of the hot box which probably was deep fried or very high in sugar.
Health and wellbeing is really important to Seqwater because we believe in our people, in developing our people, and also the health and wellbeing is a really important part of it. And it's vital that we focus on the health and wellbeing of people as opposed to just, preventing injuries. We also want to get into those lead indicator spaces in safety, and if we invest in our people and keep them healthy and well, then we'll know that we'll get the best out of them in the workplace.
Port of Brisbane's Healthy Lifestyle program is one that we're extremely proud of. This has become a great place to work. We ran an engagement survey with the staff just late last year, and our staff engagement results have increased by another 30% as a result of introducing these programs.
The Health and Wellbeing initiative was going pretty well, and I thought what we would do is try and introduce it on a wider scale. And seems we had contact here at the Sunshine Coast University Hospital, I would approach Lend-Lease and see whether we might be able to keep that Health and Wellbeing initiative alive and see if we could just build on that and see if we could reach a little bit further to a lot more people. Lend-Lease were really supportive when we proposed the idea about our health and wellbeing initiative, and we thought, isn't this an excellent opportunity to reach many people in the construction industry all in the one place at the one site. Lend-Lease were able to actually implement some of this communication through toolbox talks, text messaging, the OH&S talks with the blokes, so it was able to keep going just through those regular communications on site.
I think strong leadership is fundamental in establishing a wellness program, having leaders who are wellness role models, but also having that visible commitment to workplace health and wellbeing.
We're very lucky in Seqwater. We have a strong management commitment to our health and wellbeing program. More importantly, it is integrated into our management system, so in that, the executives, the CEO, all the way to the board regularly receive reports, and luckily for me, with the information, the evidence I gather about the improvement in risk factors and the reduction in risk factors amongst our staff, I then can go back to them and show them how important the program is being, improving the health and wellbeing of our staff and then reducing those overall risk factors. So we're very lucky now that the program's been running for a period of time, that we're able to show now some real evidence and proof about how effective this program is for us.
There have been many improvements since we've started our health and wellbeing program, and I think the biggest one is the workers are happier. They don't have many days off work, they're not sick, and definitely up there for me, it's just less injuries, and that's what we're all trying to aim for.
On a personal level, for me, it's been an amazing journey to be a part of our transformation. I now have realised that, as even a senior manager in the business, you can affect people's lives every day.
If I was going to give any advice to any other businesses starting up a health and wellbeing initiative in their workplace, I would just tell them to start off very small and build on that. Once you've got the workers' trust, then I think you can do bigger and better things.
Leadership here at the Port is not about chain of command. It's about the management team getting involved with the rest of the staff, integrating with them and working with them to improve the healthy outcomes. Talk to the staff, focus heavily on the positives. They're your building blocks to find further improvement in the outcomes for safety and health and wellbeing.